This is a case study of plantar melanoma. Melanoma, one of the cancers of the skin, is the deadliest cancer. Melanoma on the foot is the most deadly melanoma per occurrence, as it is usually found and treated too late. This is a case study of a melanoma on the plantar surface of an 83-year-old male. The lesion was discovered by a dermatologist during his routine body scan. It was biopsied and diagnosed as melanoma. The treatment was surgery as soon as possible, and it occurred on December 21st, 2015. This is the post-surgery wound 2 days after initial surgery. 1 week later, graft surgery was performed. The patient was instructed no weight is to be placed on the foot during healing, no exceptions. Lymph node testing revealed no further cancer. At the follow-up, the physician was not satisfied with the healing of the 2 weeks. He recommended and placed negative pressure wound therapy, NPWT. The equipment was placed to encourage healing. The foam dressing under the head of the NPWT became smaller as healing was progressed. The dressing was changed 3 times weekly by an RN. The first photo shows the dressing that was changed and the wound evaluated 3 times weekly. This equipment at the right is what the patient used for mobility after about 4 weeks. The NPWT therapy was removed at 10 weeks post-graft surgery. The foot was still bandaged freshly every day. It was in the granulation phase of healing at 10 weeks. Once homeostasis has been achieved, blood vessels then dilate to allow essential cells, antibodies, white blood cells, growth factors, enzymes, and nutrients to reach the wounded area. There is still no walking allowed on this foot. This photograph is 12 weeks post-graft surgery. The patient was walking some with a special shoe to keep pressure off the wound. He was told by the physician to keep it minimal. The wound was still bandaged routinely. It was in the proliferation stage of healing, when the wound is being rebuilt with new granulation tissue comprised of collagen and extracellular matrix. A new network of blood vessels develop. This is called angiogenesis. This photograph is at 16 weeks post-graft surgery. The patient still wore the shoe to keep pressure off the area, but a lighter bandage. This is in the last stage of healing, which is the maturation stage. It is the final phase and occurs once the wound has closed. This stage of healing may go for months. It's the remodeling of type 1 and 3 collagen. At 10 months post-graft surgery, the foot is considered fully healed, though it may still progress for a short time. The area is sensitive due to lack of natural padding, so appropriate cushioning is worn inside shoes to compensate. No special shoe is needed. The patient walks normally and is pleased with the result. He says, "It's just now to the point of not always bothering me." This case study on melanoma on the foot accentuates the need for 3 things. First, a yearly dermatological exam. Second, examination at each routine healthcare appointment by physicians and other caregivers. 3, education of the patient for needed daily examination of the feet. Thank you for your interest in our case study. Future studies may be made available from time to time. Be sure to check back with us on our website at www.prof-ed.com.